Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I'm really happy to be talking about this subject because it's something I've been doing for the last 18 years of my practice at Performance Medicine. We're going to talk about the safety of women's hormone replacement therapy and really the necessity of it. And what brought this up, I watched a program on one of the news stations the other night. This was mainstream media. It was actually a talk show, and Dr. Marty Makary, who's now our commissioner or the FDA, was talking about women's hormone replacement therapy. Now, I've followed Dr. Makary for years. He's a very distinguished professor at Johns Hopkins. He's a surgeon, and he's a healthcare researcher. He's into public health. He's really, there's no way you can dispute this guy's qualifications. Plus, he has a lot of common sense. He's for patient advocacy. He wrote the book Blind Spots, which I read and gave to all my practitioners that work with me. And what that book talks about is how doctors in the medical system have this terrible thing called cognitive dissonance. And that's when doctors just kind of go along with the way they've been practicing for years, despite new evidence and sometimes old evidence that it was the wrong way to practice. And so if you want to read a good book about the medical care system now, read Cognitive Dissonance about it in Blind Spots by Dr. Makary. But anyway, so now he's the head of our FDA, thank God, and he's going to bring about some much needed changes. And when I saw this on bioidentical hormone replacement, I was very happy about it. As you know, the recent Blackbox labeling off of testosterone was removed because it does not cause blood clots, heart disease, and it also does not cause prostate cancer. So there's a lot of false beliefs that doctors believed 40 years ago that they still refuse to learn new stuff about. So as you know, probably the main thing I've done for the last 18 years in my practice at Performance Medicine is hormone replacement therapy. Also treat a lot of metabolic dysfunction. So I was very happy to see him on this talk show talking about how he is moving to really have them remove the black box labels off of women's hormone therapies because there's no evidence that that bioidentical hormone replacement therapy causes blood clots, heart disease, or breast cancer. In fact, it's very protective. And I like the fact that, and I'm going to play this tape for you. I usually don't play a lot of other physicians' tapes, but you're going to see this tape, and please listen to it, especially if you're a woman thinking about hormone replacement therapy, which you desperately need. In most cases, there's a few cases where you don't want it, but that's why you need to come to somebody who knows about it, and doctors are not being taught about it. I had a gynecologist recently tell me there was no difference between micronized progesterone and methylated progesterone or medroxyprogesterone, which is totally false. But it's not their fault. They just weren't taught this in medical school and residency. They don't know about it because there's no drug rep bringing around, talking about it. So these are things that all doctors, especially gynecologists and family doctors and internal medicine docs, need to know about to educate their patients about hormone replacement therapy. Because if you start hormone replacement therapy within 10 years of menopause, you're doing yourself a big, big favor. And again, the results of the WHI study back in 2003 were totally misleading. And it unfortunately led to a whole generation of women being denied these life-saving bioidentical hormone replacement therapies. We're not using Premarin and Prempro anymore, although that's better than taking nothing. But we've got these wonderful bioidentical hormone replacement therapies that I've been doing for the last 18 years. That's what I received my board certification in with integrative medicine. That's how I started out with this thing. But anyway, so hopefully they'll remove the black box warning and you can visit a healthcare provider who knows something about these bioidentical hormones, like performance medicine. That's been our main topic of treatment for the last 18 years that I've been doing this. So doctors slowly come around to some of this stuff, but I love what Dr. Marty Makary says about this because he's outspoken and nobody can question his legitimacy. I mean, they could not say a word about him. They could not censor him during COVID. He came out against a lot of the ways that our healthcare system was treating COVID and still is. So he's a very trusted healthcare provider. So please listen to this video on hormone replacement therapy and the fallacies of that women's health initiative that led doctors and patients, misguided them to miss out on these wonderful hormone replacement therapies, especially as you age and go into menopause. So ladies, please listen to this, look at the evidence, share this with your friends, and hopefully you'll be much healthier and live a much better life. And again, even in this, he's just talking about estrogen and progesterone replacement therapy. He's not even talking about the wonderful benefits of a little bit of testosterone therapy in women that's so desperately needed. So listen to this video. He talks about how it doesn't cause breast cancer, blood clots, heart disease. In fact, it's way more beneficial to take bioidentical hormones than it is in taking a statin to prevent heart disease. That's major. That's a major thing. And he doesn't even really touch on how it prevents or helps prevent dementia, osteoporosis, muscle wasting, and all the other things that it does. So go to this video and please talk to a doctor who knows a lot about bioidentical hormone replacement like we do at Performance Medicine. All right, listen to this, share it. I'll see you next week.
Okay, I also want to stay on women's health because there's some new work that you guys have been doing around hormone replacement therapy for women in menopause. This is something that women have shied away from in the past because of studies that incorrectly linked it to breast cancer. Talk a little bit about more of what you're finding here, what women should know.
So women live longer and feel better when they start hormone replacement therapy within 10 years of the onset of menopause. We're talking about estrogen or estrogen plus progesterone. Doctors had been prescribing it for decades with tremendous short-term health benefits for candidate women, which are most women. There are rare contraindications. But not only did they see the short-term benefits of alleviating the hot flashes and night sweats and weight gain and mood swings, but they also noticed tremendous long-term health benefits now validated in major studies and clinical trials. We're talking about reducing the #1 cause of death in women, that is fatal heart attacks, by 25 to 50%. I mean, that's more powerful than statins. Reducing cognitive decline by up to 64% and reducing the risk of Alzheimer's in one study by 35%. So we've got billion-dollar Alzheimer's drugs. We need to talk about prevention and the tremendous health benefits. Now, the FDA is not your doctor, but women have not been offered this medication, tragically, for 22 years because of a dogma after the announcement of a study in the media, before it even came out in the medical journals, that it increases your risk of breast cancer. Turns out that study did not show a statistically significant increase in breast cancer, and that's no subsequent clinical trial has ever found that it increases the risk of breast cancer mortality. And so that's valuable information every woman should know. Tragically, because we felt like in the medical field, well, we can't treat menopause and perimenopause.
Right.
Why even teach it? So there's little education. It's been massively understood, underappreciated, underfunded. And so you have women that come in with symptoms of menopause, and they're more likely to be prescribed an antidepressant today in America because this dogma still lives on. 50 million women over the last 22 years have been denied this powerful therapy, which may represent the number one or two most powerful therapy in improving the health outcomes of a population when it comes to women. And so every woman needs to know about this and watch our FDA expert panel that just took place.